So we've digested, now what? Now we have to absorb it and get it into the system. So let's take a look at carbohydrate absorption. So we break it down into its individual monosaccharide components. We then transport them across. All of these transporters are hormone insensitive, means they work without having any other signal beyond the sugar being there. We have what's referred to as the salt galactose transporter. It's going to transport sodium with galactose. Glucose will follow along on that as a symporter with the sodium. And then we have the GLUT5 transporter, which is a fructose transporter. They then get moved across the cell and then get dumped into the interstitial fluid on the mesenchyme side in the lacteals to go into the lacteal capillaries to be transported wherever they need to go. On the pump side here, we do have a sodium-potassium pump at play. And the sodium-potassium pump is going to be utilizing the sodium to draw across and move sodium into the interstitial area. That's where the water, in terms of the heavy water need for absorption, comes into play, because the water molecule is going to follow the salt and follow this glucose. We're going to talk about hydration issues. The number one reason why we add glucose or a glucose substitute and salts into sports drinks is because when it absorbs, water is going to be following along with it. Amino acids is also going to have a heavy water draw, and it has a heavy water draw because it uses symporters again. That symporter is going to be moving an amino acid with it. The movement across, as it moves across, dipeptides and oligopeptides that do get absorbed will get further digested down into their individual amino acid components, or components of the amino acids will then get transported across and moved to wherever they get moved to. The last one's a little bit more complex, and that's simply because of the nature of lipids within the water environment. So we have the fatty acids come in, the lipids, they get broken down either into their free fatty acid components or into their myocyl components. Because they're lipids, they don't need a transporter, they move straight through. Lipid soluble. They move straight through. The fatty acids interact with a kinase and get turned into a phospholipid. The phospholipids will coalesce around themselves and get transported through the blood as phospholipids. Everything else will break apart, pass through the smooth endoplasmic reticulum and the Golgi apparatus, and get vesiculated. They get vesiculated into chylomicrons. That includes the cholesterol molecules that were stabilizing the mycel. These will then go into the lymphatic system and into the hepatic portal system, straight to the liver. The fatty acids can go through the portal system, but can go into the capillaries to go out into normal circulation. After passing through the liver, the chylomicrons will exit as VLDLs or LDLs. They will then go into circulation and get repackaged through interactions with lipoproteases as the next dense level of cholesterols. So, when we talk about cholesterols, we're talking about these structures here. Chylomicrons get processed down into the VLDLs. The VLDLs get processed down into the intermediates, which get processed down into the low density, which then get processed down into the high density. Now, if you notice, on each time it gets processed, we lose the fat molecules within the vesicle. The loss of the fat molecules, the yellow dots here, is the interaction of, is the indication for how dense that sphere happens to be. The less dense that sphere, the more likely it is to be to the outer surface of the plasma as it moves through the vessels. These areas here, within the red, is going to trap any antigen markers that may have come in with the cholesterol molecules during digestion, and that's what causes the atherosclerotic immune response. Because it's a mixed antigen marker, they attach on, they bind on, and then the immune cells come in and take care of that antigen marker. In terms of electrolytes, electrolytes and water can be absorbed throughout the whole entire length of the system. However, most of it's going to be taking place within the large intestine based off a percentage of stuff being absorbed. The vitamins, the fat-soluble vitamins, have to be absorbed within the chylomicrons and within the myoceles. The water-soluble ones will follow along in a Symport method with the salts in the water. So if we look at it, water is going to be absorbed throughout based off of movement of salt. As salt is moved, the water-soluble vitamins, in particular the B vitamins and C vitamins, will be absorbed. Water is going to follow along. In terms of the fat solubles will be absorbed in the myoceles and then transported in the chylomicrons. When we look at measurements of the fat-soluble vitamins, we have to be very careful, because just because you have low levels in the plasma does not mean you have a vitamin deficiency, because fat-soluble vitamins can be found in any tissue that has what? Fat, because it's fat-soluble. Questions?